Sensory Perception Nursing Fundamentals Practice Questions. Question 1. A nurse is caring for a patient whose cultural beliefs influence healthcare decisions. What is the nurse's priority action? Option A. Assume all family members share the same beliefs. Option B. Assess the patient's individual preferences and values. Option C. Avoid discussing cultural beliefs. Option D. Apply the same care approach used for all patients. The correct answer is option B. Assess the patient's individual preferences and values. Individual assessment prevents stereotyping and promotes culturally competent care. Question 2. A patient requests a spiritual leader before a major procedure. What is the nurse's best response? Option A. Explain that spirituality is unrelated to healthcare. Option B. Facilitate the request whenever possible. Option C. Delay the procedure without notifying anyone. Option D. Discourage the request. The correct answer is option B. Facilitate the request whenever possible. Supporting spiritual needs can improve coping and emotional well-being. Question 3. Which statement best reflects cultural humility? Option A. I know everything about this culture. Option B. I am willing to learn from the patient's experiences. Option C. All patients from this culture believe the same thing. Option D. Cultural beliefs should not affect care. The correct answer is option B. I am willing to learn from the patient's experiences. Cultural humility emphasizes openness, self-reflection, and lifelong learning. Question 4. A patient speaks limited English. What action best promotes effective communication? Option A. Use medical jargon. Option B. Speak louder in English. Option C. Use a qualified medical interpreter. Option D. Rely on another patient for translation. The correct answer is option C. Use a qualified medical interpreter. Professional interpreters improve accuracy, safety, and patient understanding. Question 5. Which nursing action demonstrates respect for cultural diversity? Option A. Making assumptions based on appearance. Option B. Asking patients about cultural preferences related to care. Option C. Ignoring cultural practices. Option D. Discouraging traditional health beliefs. The correct answer is option B. Asking patients about cultural preferences related to care. Open-ended questions help nurses understand and respect individual needs. Question 6. A nurse is conducting a spiritual assessment. Which question is most appropriate? Option A. What spiritual or religious practices are important to you? Option B. Why do you believe that? Option C. Do you attend services every day? Option D. Should everyone follow your beliefs? The correct answer is option A. What spiritual or religious practices are important to you? This question encourages discussion without judgment or assumptions. Question 7. A patient declines a treatment due to religious beliefs. What is the nurse's priority responsibility? Option A. Force treatment. Option B. Respect the decision and notify the healthcare team. Option C. Ignore the refusal. Option D. Document only if complications occur. The correct answer is option B. Respect the decision and notify the healthcare team. Patients have the right to make informed healthcare decisions consistent with their values. Question 8. Which statement about culture is accurate? Option A. Culture affects only language. Option B. Culture influences health beliefs and behaviors. Option C. Culture never changes. Option D. Culture applies only to ethnicity. The correct answer is option B. Culture influences health beliefs and behaviors. Cultural factors can shape health practices, communication, and decision-making. Question 9. A nurse notices personal biases affecting interactions with a patient. What should the nurse do? Option A, ignore the issue. Option B, reflect on the bias and provide equitable care. Option C, transfer all responsibility immediately. Option D, avoid speaking with the patient. The correct answer is option B. Reflect on the bias and provide equitable care. Self-awareness helps nurses provide respectful and unbiased care. Question 10. Which action supports culturally competent care? Option A. Using stereotypes to predict preferences. Option B, tailoring care to patient values and beliefs. Option C, treating cultural concerns as unimportant. Option D, avoiding discussions about traditions. The correct answer is option B. Tailoring care to patient values and beliefs. Individualized care improves trust and patient outcomes. Question 11. A patient expresses spiritual distress after a serious diagnosis. Which nursing response is best? Option A, change the subject. Option B, encourage the patient to discuss concerns and sources of support. Option C, provide personal religious opinions. Option D, discourage emotional expression. The correct answer is option B. Encourage the patient to discuss concerns and sources of support. Exploring concerns helps identify resources and coping strategies. Question 12. What is the primary purpose of a cultural assessment? Option A, label patients into groups. Option B, understand factors that may influence care and communication. Option C, replace physical assessment findings. Option D, determine socioeconomic status only. The correct answer is option B. Understand factors that may influence care and communication. Cultural assessments help nurses deliver patient-centered care. Question 13. A family requests involvement in healthcare decisions according to cultural traditions. What should the nurse do first? Option A, assess the patient's preferences regarding family involvement. Option B, refuse family participation. Option C, discuss only with the physician. Option D, exclude the family from meetings. The correct answer is option A. Assess the patient's preferences regarding family involvement. Patient preferences guide decision-making while respecting cultural values. Question 14. Which finding may indicate spiritual well-being? Option A, persistent hopelessness. Option B, a sense of meaning and purpose. Option C, complete social isolation. Option D, refusal to discuss values. The correct answer is option B, a sense of meaning and purpose. Spiritual well-being often includes meaning, hope, and connection. Question 15. A nurse provides care without discrimination regardless of cultural background. Which ethical principle is demonstrated? Option A, justice. Option B, paternalism. Option C, beneficence only. Option D, fidelity only. The correct answer is option A, justice. Justice involves fairness, equality, and respect for all individuals.